Hello, and welcome everyone. Welcome to another edition of IWF's digital programming, highlighting the work of individuals that are helping to shape the world today and in the future. I'm Vernice Davis Anthony, and I'll be your host today. Just a little bit about me, not much because it would take all afternoon. I'm that age. So I started my career as a public health nurse, working on the streets of the city of Detroit, eventually moving into public health policy, getting a master's in public health from the University of Michigan School of Public Health, which some of you may be familiar with. I have served as a public health officer for the city of Detroit and Wayne County. That's two local health departments. And I've also served as a director of public health for the state of Michigan. In addition to my official public health roles, I have also served as the CEO of the Greater Detroit Area Health Council, which is a regional health business coalition that brings together the businesses and the health community and the broader community to solve issues around healthcare cost, quality, and access. Was in that role for 10 years. And also interim CEO of Focus Hope, which is a nonprofit organization in the city of Detroit that focuses on dismantling racism by providing practical programs and services to our people. And very relevant to today's topic, I also serve on Governor Whitmer, that's our governor in Michigan, on the governor's Michigan Economic Recovery Council. That is the advisory committee that the governor has created to advise her on the process and timing for the opening of our economic sector in ways that would also protect the public's health. That would include retail, factories, salons, industry, any place. So I'm busy with that committee also. And just like the rest of you on the phone, that is an ongoing process and it's a moving target. And I'm sure you are all engaged. Today, however, we're going to discuss the intersection of public health and retail. But before we begin, just a few housekeeping items. We really do want your input and your participation. So as you look at your screen, you'll see the words ask a question at the bottom. So you can submit your questions there, or you can vote for the questions you'd most like to hear answered. There's so many people, hundreds actually of you guys, on the line who can't get to every question, but we do want to answer those that the most people would need or would like that information. There's a chat on the far right side of your screen, chat boxes that you can speak to other participants if you like, or if that's a distraction for you, if you want to just make that disappear, you can take your cursor to the upper right corner of the chat field and a caret will appear. If you click on that, the chat will disappear. But I think it's kind of fun to look at to see the people from all over the world that are on this call. Very impressive. So moving on, our lives have really changed in very, very fundamental ways since the onset of COVID-19, the COVID-19 pandemic. And everything that we do has been different. And it's really, again, that is also on a moving target as we learn more and more about what is safe, what is not safe, and how the virus reacts. One of our activities that has been completely upended, of course, is that of shopping. And many of us just love to shop, just wander around stores, looking at things, even if we don't buy. But shopping has a whole different meaning now, especially that many of us were required to stay indoors unless you had to go out for essential items for weeks, if not maybe even more than that, more than a month for us here in Michigan. So we got comfortable with shopping online, calling in our orders to just go pick them up and come back home without having to go inside of the store. So shopping is not what it used to be. We even got comfortable with not buying things we used to think that we really needed to have. As you've been without it for 2 months, you say, well, actually, I don't need that at all. So it'll be a new story as we all come back out again. But some of our retailers and some of our companies are really responding to this and embracing the situation in ways that they can both protect their employees, but also ease us back into the shopping experience. And Walmart is one of those employers. I was pleased to find out today, because I did not know, that Walmart is the world's largest employer. Global workforce of over 2 million people. They're in 27 countries around the world. Another 160 million people shop in its stores every week. So what Walmart does definitely impacts what we all do, and will impact the shopping experience, globally around the world. And in some communities, Walmart may be the only place in some smaller communities, and even in some of our communities here in Michigan, where people can shop, for food or clothing or, other kind of supplies, and even medicines, a drugstore, providing healthcare, primary care, immunizations. It may be the only provider. So with that, we're very curious to know how Walmart is adapting to the coronavirus, what changes they've made, what lessons can we learn that we can share with our own employers in our own workplace. So let's ask. We have with us Walmart's Chief Medical and Analytics Officer, Dr. Thomas Van Gilder. So thank you, Dr. Van Gilder, for joining us. Very pleased that you're able to be here. Let's start with the shoppers, protecting the health and safety of the shoppers. Just recently, Walmart announced that they're going to be requiring a mask. Can you start with telling us kind of what went through your mind? What things did you consider as that decision was made?
Well, Vernice, first of all, thank you so much for having me. It's a delight to be here and to address this great body and people from all over the world. So thank you for that. Walmart really is a part of so many communities across the country, with about 4,500 stores coast to coast. 90% of the population of the country lives within 10 miles of a Walmart. And as you said, about 150, 160 million people come to a Walmart in this country every week. So we really take our role in the community very, very seriously, especially our shoppers, our customers who come to us, who entrust us with their essential supplies of food and medications and other things that keep life going, particularly in this time. So we've, from the very beginning, taken a series of measures, always guided by public health, both by public health principles, public health guidelines, CDC and other federal guidelines, state and local guidelines as well, to protect the shoppers. And the range of things have gone really from making sure we don't have too many people in the store at a time. So we have people at the front counting who comes in, stopping at about 20% of the usual capacity, and then letting additional people in as others leave the store, as well as within the store, setting up markers of social distance. So try to keep that 6-foot distance that public health asks for apart from people. We've made one-way aisles so that people don't have to be as crowded or cross paths in the shopping aisles, particularly in the grocery section. And we've limited hours in some places to try to both help us refresh the stores and keep the cleanings up to date, and make sure that we have the right, balance of availability with safety. Masks in particular, we have again followed very closely the public health guidelines. And as the state and local health departments and CDC became more outspoken or clearer in what they wanted the public to do and why, to wear masks to prevent the spread of this virus, to protect others when one wears a mask is really at the heart of what these recommendations are. And so in light of that, we've adopted that effective July 20th. We ask all of our customers coming in to shop to wear masks as they shop with us.
Yeah, there is, as you know, there's always this controversy around things that people are required to do, certainly in our country. So how's it been these first couple of days with the mask now being required?
It's really been very well received. I think the message got out. I know there have been some changes over time, but I think the message has gotten out that the virus is here. We need to do what we can to protect each other. We can't all stay indoors for an indefinite period of time. And so when you're out doing essential things like shopping, we need to take care of each other. We've instituted a role called the health ambassador towards the front of the store, just to help remind people, let them know some of the changes that you alluded to, Vernice, in the beginning of how we're shopping. And mask wearing is one of them, to remind people, to let them know what the expectations are and why they are.
Are children required to wear the masks?
Children below age 3 are not required to wear a mask.
Okay. Any special hours for seniors? Some stores are doing that. Anything like that?
Yes. In both the stores and clubs, so Sam's Clubs and the Walmart stores of all kinds, we have early morning hours for seniors in most areas, trying to keep them, again, kind of an extra layer of social distance for them. And those are available on the website to know exactly when those are and where those are in your local communities.
Okay. What about the disinfecting of the store? And, are there new cleaners, different types of cleaning products that are now being used? And how often do you do that? And talk a little bit about that part.
Thanks. Certainly, we work to keep the store fresh at all times, of course, and that's been an ongoing practice. But as this epidemic has evolved, again, following public health guidelines and FDA and EPA guidelines for the appropriate type of cleaning and type of cleaning materials, because we want to be clean, but we want to be safe for everybody as well. We've enhanced those. One of the reasons we've restricted our hours, many stores were 24-hour stores. We've restricted that so that we can spend more time cleaning when no one's in the store. When we need to do a little bit deeper cleaning, or when we want to be able to clean more broadly, we do that when the store is closed. But when the store is open, there's cleaning going on as well, to try to keep ahead of all of the needs that we have to keep our associates and our customers.
Right. I'm wondering, you are worldwide and in various communities. Is this kind of like a cookie cutter approach, or are there some variations depending on, where the store is? Or could you talk a little bit about what flexibilities, or what are some of the unique things you may have to do in some communities?
Sure. We certainly are following the guidelines from the very highest levels, WHO and CDC, and so we have that kind of baseline as well as the general public health principles, but we definitely adapt to them and adopt them for our particular communities. Some communities had mask mandates or particular requests or requirements for businesses, and we certainly followed those. And then some communities, again, with senior citizens, as you mentioned, where those are a larger component of the population, sometimes those hours were applied earlier or applied more broadly. So we certainly tailor to the communities the needs of customer safety and associate safety.
Yeah. I know that Walmart has also provided other services, glasses, hearing screening. Are those, and in some cases, primary care? For example, a nurse practitioner may be available. Are those services being continued now, or put on the back burner? Just what's happening there?
Yeah, and let me just say, in general, Walmart has been in healthcare for a long time. We have 4,500 pharmacies. People may have heard of us. I know as a primary care physician, they really entered my radar about a decade ago when they offered $4 generics to customers. But we've continued to provide those services, vision, hearing, and some primary care services. Again, kind of following with the local evaluation and evolution of the epidemic. We've restricted some of those services in places when the spread was really happening at a very rapid rate. We've restored those in certain areas and continue to look for ways to restore things like vision checks and full glasses and contact service, as well as some of the primary care delivery arms that we have.
Yeah. So if you really want to know, you need to call your local Walmart store.
Right.
Because
right.
there may be some differences there.
That's right.
You've also been a leader in immunizations. And unfortunately, during this period of COVID, we've already lost ground with childhood immunizations, for example. Kids are not getting their regular shots as they normally would. People are not keeping their regular appointments. We're expecting a flu coming up in the fall. We're going to have the convergence of COVID and the flu, perhaps, coming this fall. Could you talk a little bit about your point of view, from the position of medical director of Walmart, about what you foresee in terms of immunizations and vaccines, and how we're going to be able to handle that, as a community with your help?
Sure, thank you. CDC has warned about a possible severe flu season, either itself or, as you said, if it crosses over with COVID, either in the fall or in the winter or spring. So we're really preparing to have the immunization available as soon as it becomes available in early August, to promote its use at the appropriate time for really, CDC has universal flu vaccination recommendation. So we're really preparing to expand our ability to reach the community, and looking for not only the usual way of coming into the store and having it delivered by a pharmacist, for example, but also looking at community events, as well as raising awareness, not only delivering the vaccine, but raising awareness of it. We have, for the last several years, had wellness days about 4 times a year in all of our stores, and we've screened millions of people and delivered vaccines at those events. We're going to do that virtually to start with in the fall. So we'll still have a wellness approach, but it'll be virtual. Through that, we hope to get very practical suggestions to people about how to maintain their health, and vaccinations would be part of that as well.
Yeah, I do think, Dr. Van Gilder, that type of service is going to be extremely important coming this fall. And it may be a change of life that never goes back to the way that it was before. We're all going to have to get accustomed to the new normal and e-visits. And even before this, we've had a challenge in providing enough primary care for our communities, particularly rural communities, around our country, and I'm sure other countries. And in some urban communities, that's the only place you can go. So that's a huge role. And I'm glad to hear that you're thinking about expanding that so that people would have access via, electronic mode. And then there's so many seniors that just like to go to the store, that, that you'll be there. And whether it's blood pressure screening, or, getting your blood sugar checked, or, hey, I can't see, getting your eyes checked. And those things are extremely important. So it's good to hear that you'll be expanding that electronically, but also attempting to maintain many of those services on site.
That's right, Vernice. If I could mention, we really have expanded that primary care offering. We have now 4 what we call Walmart Health Centers, 3 in Georgia, 1 in Arkansas. That's really designed to bring primary care, dental care, behavioral health, wellness, along with the center and pharmacy that we already have, to people, especially in communities that don't have the services currently, at an affordable price, at a predictable price, and at a convenient quality that our customers expect.
That's absolutely wonderful. What is your professional opinion, I might say, on the advent of a vaccine for COVID? I mean, I'm sure you're following the journals and the news. So what's your feeling about that? What do you think?
Yeah, well, I think one of the really positive things amidst all the difficulties of the last few months is that we've been able to identify and sequence the virus. We've been able to try out different treatments, some of which I think are showing some promise. And we've been able to, as a community, as a country, and as a world, go after vaccine development. So immunizations are so very important for disease prevention, one of the real key tools in the arsenal of public health. I think specifically with this coronavirus, I think there's reasons to be hopeful. There are a lot of different approaches, and you've seen recently some positive feedback. But I think we also have to keep in mind that the things like hand hygiene, social distancing, mask wearing, staying home if you're sick, protecting people who are in vulnerable populations is going to remain a key part of how we go forward with this. So I'm hopeful with respect to vaccine development, but all the other pillars of public health need to stay in place as well.
That's great. One of the things that you and I were chatting about before we got on air is that the whole world now is beginning to, at least most of it, respect, the role of public health. Something as simple as hand washing, public health 101, hand washing frequently. Hopefully some of these habits, if we're all able to get them ingrained, will continue even after that, because after the coronavirus, there'll be another virus, there'll be another flu, and hand washing is one of the first lines of defense to being a healthy person and free from germs and bacteria. So this can go a long way in maintaining the health of people many years into the future, and having people understand the value of public health, which usually nobody knows about unless there's an outbreak, because you don't know that you avoided I was around when the smallpox vaccine first came out. I remember standing in long lines as a kid to get the smallpox vaccine, because kids were on iron lungs and crippled for life, that type of thing. So hopefully we can have a better distribution system when the vaccine comes out for COVID. And we'll have a major, you already mentioned this community education role in terms of informing the community on the value, of vaccines, as well as, where to go. So you guys will be probably participating in giving out those vaccines. And you may not know for sure, but are you anticipating that?
Yeah, we anticipate being able to support that effort as it becomes available through the pharmacies. And I think, Vernice, your broader point too about health is such a good one, that not only public health education, I think, is really ramped up in this country, but also awareness of overall health. I think it's important to note that some of the conditions that seem to lead to more serious illness for people who are infected with this virus are things that we often know about, but maybe we don't do enough about. Blood pressure, high blood pressure, for example, and blood pressure screening, being overweight or obese, and understanding that and having some strategies for moving that forward. And those are areas, I mentioned the virtual wellness days, that we really want to focus on, because it's not only good for the current situation, but good for overall health and good for leading a happier and longer life.
Exactly. I'm not really seeing any questions yet, ladies, from the audience. I don't know how you get those up there for me to see, but I'm just wondering if there are any other questions along these lines before we transition to talk a little bit more about issues around employees and how that's managed. So with your employees, you said you had how many associates worldwide?
We have 1.5 million in this country, about a little over 2 million worldwide.
Oh, wow. Could you talk a little bit about what you're doing to help maintain the health and safety of your employees?
Right. Vernice, all those things that I mentioned with respect to keeping the customers safe are also designed to help keep our associates safe. We also encourage things like social distancing, mask wearing, which we required started back in April for our associates, as well as temperature checks and screening for symptoms and exposures really throughout the epidemic. Importantly, I think too, supporting people who are either known to be positive or ill with COVID, or may have been exposed and so are quarantined or isolated, and people who just have concerns about their health. We support them in various ways through adjusted and enhanced leave policies. We've also really worked to make sure that whatever guidelines have changed, however we can keep people safe, we've implemented. You've seen, if you've been in a store, sneeze guards for the pharmacists, for the cashiers, and wherever that helps to maintain the social distance. We've tried to provide hand soap and ability to wash hands and hand sanitizer wherever necessary, as well as the cleaning supplies that we discussed before. So really trying to make sure that we give everything we can to keep our associates safe. They've been designated as part of the critical infrastructure, essential workers, to keep food and other essential elements available to the community. So we want to make sure we protect them. We're so grateful to them. We've had special bonuses that have been distributed. We've advanced the annual bonus ahead to help keep people who work for us employed and supported. So really trying to take care of the whole person as we work through this epidemic together.
Yeah, well, thank you. One of the questions that's coming up from our wide audience is back really again to the mask, as they are also to protect the employees. One of the reasons why you're asking your customers to wear that. How will you be able to, or what is the plan to enforce that? Are employees empowered to enforce this requirement? And what is Walmart thinking about in terms of diffusing really instances that might occur with customers that don't want to wear a mask?
Well, as we've mentioned a couple of times, we have 150 million people coming to the stores every week. So we have lots of people and lots of experience interacting with our customers. Our associates come from the communities where the stores are. So there's a real familiarity and I think oftentimes a real fellow feeling there between the customers and the associates, because they're all from the same community. And we really work to encourage that. And we use education and signage and reminders to help keep people know that. I mentioned already the health ambassador that we've recently instituted to be at the front of the store to help people understand why this is happening. Most jurisdictions, most locales have exceptions. So people with health problems or other issues that may prevent them from wearing a mask. And, the health ambassador is there to help navigate those encounters, because as we've seen, it's not everybody has responded in the same way to the mask requests or requirements. Right. And so we're trying to mediate that where we can.
Okay. Along those same lines, will you not allow entrance to people that come without a mask?
Not allow entrance into the store?
Into the store, yes.
Well, again, I think what we're going to do and what we've done already is really appeal to people's sense of community, make those masks available if somebody doesn't have one, remind people that, as you mentioned earlier, sometimes the way we shop has changed. We do have home delivery. We do have curbside pickup, including for medications. So there are ways to get the things that you need without having to enter the store. We want to make sure that those are available to people and people are aware of them and know how to use them as well. Okay.
And hand sanitizers all around the store?
Hand sanitizer, cart cleaning wipes, and the constant cleaning on our staff's part to keep the carts clean as well.
Okay. What action do you take when you find an employee that has been confirmed positive with COVID?
Well, we actively follow that. Again, we have this enhanced leave policy, so people are aware of that. That's communicated really daily, so they know what their benefits are, how they're supported through it. Make sure they're aware of the community testing resources and health resources available to them, and importantly, too, having behavioral health or mental health benefits available telephonically. The way we usually do, but also making sure people are aware of that, because this is a very stressful time. Even when the illness, and for some people, the illness hasn't been too severe, but being quarantined or isolated at home has effects. So we want to make sure those needs are supported as well. And then we let people know about the positives and let them know in a respectful way, in ways that protect people's privacy of what's happening in the community and how we're supporting them.
So you would let the other employees know, and the community.
We have daily. Yes, we have good relationships with the health departments. We have daily communications within the store that include discussions of what's happening both in the community and in the store.
So on a daily basis, are the employees screened in any way, or
yes?
How's that work?
Yeah, as they enter the store, as any employee or vendor, as they enter the store, they're screened with a questionnaire of symptoms, as well as of possible exposure, and they have their temperature checked through a so-called touchless thermometer, infrared forehead thermometer, to see if they're running a fever that maybe they were not aware of.
Okay, sounds good. Sounds good. You mentioned that you have. Did you say expanded benefits, or if an employee gets COVID?
Right, we've enhanced their leave policies to help support people who can't come to work because they're ill or because they've been told to stay home by their doctor or by the health department.
Okay. I've noticed, that sometimes the employees don't always comply. So, and with that many stores and that many people, how is that managed? I guess I don't want to answer that. I just feel like I just want to go on and answer for you, but
Sure.
I won't.
Sure. Well, again, the daily communications and reminders, the signs and education that we deliver, again, very, very locally, which we think is very important to have the store staff do some of the education supplied by us, sometimes supplemented by messages from the leaders of the company, from the CEO on through. As well, we offer supplies, and we offer ways of coping with some of the different needs that people might have for protection. And again, excuse me, if somebody is concerned and doesn't think that working right now is suitable, we have leave policies to help address that as well. So it's really communication, education, daily reinforcement of the needs of the communities, of our associates, and the seriousness of the epidemic.
There is a major, or significant, I should say, variation among states, as to what is required and what isn't. And given that you're all over, not just the United States, but the world, how do you wade through that with the various states? And you mentioned CDC as being the guide that you follow, but how do you wade through the various different approaches that some of the states are having with the issues around safety, including the safety of your employees?
Well, we really monitor it very closely. A lot of communication, regular meetings that we've been having for months now to discuss these. We rely on our local support staff and our field staff, and the communication that we have there is very strong. And as you may have heard Doug McMillan recently say, when there are things that are happening in the majority of the places that we are, the mask mandate from local jurisdictions, local governments was among them. We say, let's do that for everybody, because we've got it in those places anyway. Let's do it for everybody.
Yes. Okay. Now, just moving on to some more general questions. Since Walmart is obviously a leader, one of just looking at the questions that have been asked, what advice would you give other companies that are opening back up? What are the main things that you think needs to be in place to assure safety of the employees and their community or their customer?
I think there's so many, and you've alluded to this, Vernice, there's so many specifics in any particular workplace or community that I think the advice we would give, first of all, would be, things that we're already doing. So we wouldn't suggest somebody do something that we're not doing. But it really is a matter of those core principles of hygiene, protection through social distancing, masks, sneeze guards, and things of that sort. Making sure that you're paying attention to what's happening in the local community. Early on, what was happening in New York was not what was happening in Texas, and now what's happening in Texas is not what's happening in New York. So being aware of what's happening in your community and your state and acting accordingly. So not getting too far ahead of where the numbers are telling us things are happening. And I think those general guidelines, following what local, state, and federal public health are guiding, and being aware of your surroundings is just the key to fighting this.
Okay, another question that I'm seeing on the screen is that is there any training for the employees on how to handle customers who are resistant? This person says they've seen some videos, and it seems that Walmart employees seem to have a pretty good handle on how to work with customers who may challenge it. So they're wondering, do you have any training or any advice you can give as to how the employee can handle, since you seem to be doing, at least based on this question, a pretty good job with your employees as far as managing recalcitrant or customers that don't want to wear a mask.
Well, thanks for that, and appreciate the question. And I say this, I've been with Walmart for about 2 years, and I just am in awe every day of what our store associates, our frontline associates do for each other, for our customers throughout not only this epidemic, but really on a daily basis. And I think part of that, again, is that community basis for the stores and the connection to the communities. And there is, I think, a real emphasis on training, on customer service and customer first attitudes. That's really part of the DNA of the company from its founder, Sam Walton. And what we try to do, we have training available locally. We create training videos and training materials from the home office, the headquarters, and send those out, and really try to make them all about how do you interact best with a customer. Really, this customer service focus is throughout, and we've just had to add additional specifics around this epidemic, but they've been well received, and it's a well-trained workforce to start with that really has the customer first. So adding that additional layer has been, I think, a natural extension of the service that our frontline associates give every day.
Would any of those videos be shareable? Are you sharing those with other companies?
Let me take that back and ask. I mean, our CEO, Doug McMillan, leads the business roundtable now, and I know there's a lot of sharing among companies in that way, at least of ideas. But let me take that back, Vernice, and see what's available.
Okay, that would be helpful. And I think too that you mentioned earlier that your employees really are from those communities, so they're talking to their neighbors. I mean, they're talking to people that they see, other places on the street and in the community. And that probably helps too. Just respecting, even if someone's opinion is different from yours, having a respect that they may think their opinion is valid.
That's right.
So I think that makes a big difference, as well as a training and monitoring. Your requirement that masks be worn has been in place now, for 2 days or 3 days?
Made the announcement 2 days ago, I believe, and then it begins. We've made the announcement. We've made the request. The start of the requirement per se is July 20th.
Oh, so really the requirement hasn't started yet.
Correct.
Yeah, because the question was, have you noticed that more people are wearing them, in your stores? And so is there a way that you're going to measure that so that as a store you could know?
Yeah, I mean, part of that communication is that feedback of how are things going, what more can we do to help, and what are we hearing, what are we hearing from our customers, and we actively monitor the social media feedback we get, as well as the in-person feedback that we get from our customers.
Does Walmart require the face mask in all countries, or is this just the USA?
This one is directed at the U.S. There are other things that are appropriate to the local areas as well that are in place and have been. As you know, we're experiencing this country. Our country is experiencing this epidemic a little bit differently now than others are. So different mandates and policies and procedures in place in different locations.
Employees working at home, assuming there's still a significant number who don't serve customers that are working at home. Do you know how long that's likely to continue, or how are you making your decisions along those lines?
Now, that's been an active area of consideration from the very beginning, from how do we keep our home offices, as they're called, or corporate offices, clean and ready for when people return. What do we do for people who are essential in the building type employees, and applying some of the same principles that I mentioned for our store associates to those associates. And then really, again, following public health guidelines, following the data of positive cases in a particular community, and letting that lead us. So the company, I think, has done a great job. Walmart has done a great job of supporting the at-home associates, and we want to continue to support them in that same way to make sure that any return is safe. But we're monitoring locally, and we will continue to keep the safety measures in place to keep people safe.
Yeah, thank you for that. I think that the community education role or responsibility of large companies is really coming into play now in major ways. And I see that Walmart really could have an even greater role in influencing the community outside of just focusing on, say, your customers and your employees. Have you given any thought to what else you can do as a company that's the size and breadth and depth that you are?
Yes, we really look for ways of supporting the community in general, and there are a number of programs that really bring the community in, including people who are not regular shoppers, or we go out in the community and help support that. I think one concrete example I'd give relevant to the epidemic is our support and partnership with the U.S. Department of Health and Human Services, as well as state and local health departments, in opening our parking lots up for testing, providing our pharmacists and other pharmacy techs and other workers to support the logistics, and in some cases actually do the testing. So we've really, that's been open to whoever public health wanted to have tested. We weren't, this wasn't limited to our customers, or we weren't picking and choosing. It was public health had groups they wanted tested, and we were there to help with that. And we continue those partnerships and to look for ways that we can support our communities in all sorts of ways.
That's excellent. That's excellent. One of the other questions was similar to that in terms of being involved with your community, whether that's supporting the local food bank or contributing to areas where there needs additional backup or support, helping with access to medications, for example. Do you have any examples of some of the things that Walmart is doing along those lines?
I think a recent example, Vernice, that I'm really proud of our CEO and the company for doing is standing with Chicago in particular. Mayor Lightfoot and our CEO Doug McMillon, made an announcement about reopening the stores that had some difficulties during some of the recent unrest, as well as expanding our health services there. So the Walmart health centers that I mentioned will be going into 2 of the locations in Chicago, in neighborhoods that have a lot of needs. And we're listening to the communities, listening to what everyone needs there. And it's not just all about the groceries, which I think are essential, and some of the other goods that people require, but also the healthcare tuned to the community, so that we understand what the needs are and are able to provide them in ways that customers expect. So I think that's a great recent concrete example of how we're going a little bit further into communities and supporting them.
Yeah, that's wonderful. I think that's the true measure of a very concerned company, that you step outside of your own bottom line to interact and help the broader community be healthier, because we're all healthier. We would say from the Greater Detroit Area Health Council, healthy people, healthy economy. That they fit together, hand in glove. Equally important, healthy people. You can't have a healthy economy without healthy people, and you can't have healthy people unless you have a healthy economy. So the more that any company does to recognize that, the more they should be, I think, applauded and supported. Let's see what other questions we might have here that we haven't addressed. Couple other questions from our more general questions. Drawing from your own public health experience. Now I'm back to you, Dr. Van Gilder. You said you were a primary care physician before this. Did I hear you say that?
Yep.
What do you think people should be most concerned about right now?
I think, Vernice, one of the things that I've said to our associates and to other communities is a simple acronym: MEDS. Take your meds, where M stands for move. So exercise doesn't have to be fancy, just a walk or a stretch. Eat for eat regularly, eat well, eat whole foods, and eat mindfully, watch what you eat. D for de-stress, so find time to relax, find things that you enjoy and take time to do those. And then S, probably the most important, sleep. Really prioritize the quality of sleep, because there are all sorts of very particular things that people might do based on their health conditions or their life conditions. But those are things that we can all do that would not only help our overall health, but help us in this particular epidemic, and then also really help build resilience in ourselves and our families, and then in our communities. Because I think ultimately, as all epidemics do, this will pass, and we will get past it, and for using various tools, and the virus itself will fade away as they do. We have to be prepared and continue to work hard to make that happen. That will happen. But what we'll have is some lasting effects from people who have been disconnected from loved ones, or have had to make adjustments in their life that are not always pleasant. So to do the things that we can each do for ourselves and for our families, I think is really critically important. And that's what I tell people, how to really approach things today. Pay attention to your health, pay attention to your behavioral health, pay attention to your loved ones in your communities, and stay as connected as you can.
I hope everybody was taking notes on that, what you just said, in terms of being healthy at the outset. And if you're healthier, you're much less likely to suffer complications from, whether it's the chronic diseases or whether it's another virus, that then you're in a weakened state because you haven't been working out, or you haven't been eating properly, and you have other issues just because you're not healthy at the beginning. And I'm saying this recognizing that there are many people, and as we know, particularly in the African-American community and other Chicago urban areas, where the large populations really don't have access to the tools to be healthy. And of course, that then makes them much more vulnerable to complications from whether it's coronavirus or another virus that comes along. And we just all need to be mindful. We just all need to be mindful of that. So what keeps you up at night, Dr. Van Gilder?
Well, as I said, sleep is so very important, so I try not to let anything keep me up. But I think the things, Bernice, some of the last comments you made, I think there are so many opportunities that we have in this country to help each other, to understand health, understand the importance of communities in health. Because I really think, and you made this point earlier, that health is really a community resource and a community opportunity. It's not just whether I stretch or I work out or I get proper sleep. It's really something we have to help each other understand, make it important and understandable to each, because there are, as we see across the populations and across time, there are populations and communities that seem to be more have more difficulties with any health condition or any virus or any chronic condition that comes around. And I think it's just very important to understand the risk factors, as we say in public health, or some of the causes for that, and to support that. And that's, again, one of the things that I think I'm so excited about with some of the things that we're doing in the Walmart Health Centers, is really trying to bring access, affordability, and necessary and very practical tools and teaching and support for the communities that need it most.
Exactly. You mentioned that you were opening some of those clinics in Chicago. And I happen to be doing this interview from Chicago, here visiting. So shout out to Chicago IWF. But my home IWF, of course, is Michigan and Detroit. So a big shout out to Detroit and all the IWF ladies from Michigan that are listening in on this interview. I'm so pleased that IWF, brought us together to have this discussion today. So, we have about maybe 10 minutes left. So, Dr. Van Gilder, could you talk just a little bit more about what you expect the future to look like in terms of Walmart, as well as delivery of healthcare and the things that Walmart is most concerned about? If you had a crystal ball, what do you see?
I think what we're seeing, Vernice, and we said this a little bit about public health awareness, I think we're seeing people becoming more aware of how our health system operates, where some opportunities might be to improve that. Some of that could come through digital engagement. Some of it could come through more at home or non-traditional, at least to our system, non-traditional delivery sources. And I think that's where we see ourselves as being able to play a very significant role in people's lives. As I said, with 150 million people coming to a Walmart every week in this country, that's a real opportunity to have influence in people's health. And we've already been doing that directly through some of the pharmacy work and vision center work that's available, but also through the availability of fresh fruits and vegetables and food, equipment and other things that help people stay healthy or keep them in fitness gear, for example, but aware of health. And I think as that becomes a real part of our everyday more broadly, I think we will see healthcare happening in a way that is on the customer or patient's terms rather than always at the system's terms. And that's, again, why we want to bring these health centers and these health offerings into our communities and make them available at affordable prices, at predictable and transparent prices, but with the same quality that you'd get anywhere. So we really want to make that a central part of our health and wellness philosophy and strategy, really. And we're doing that again through these health centers. You'll start to see even more services being available through our pharmacies. That's another, I think, advance or at least change that we're seeing in our healthcare delivery system, whether it's because people don't have access to any healthcare or because primary care is in shortage and in short supply. I think we're going to see pharmacists playing a greater and greater role, again, with safety and quality, but a greater role in the health of our communities, not just with prescriptions, but with healthcare services and chronic disease management. So I think that the increased availability and the availability of healthcare on a customer or patient's terms and within his or her lifestyle or life flow is where I think we're going to see real improvements in healthcare in this country.
That's excellent. I really appreciate your foresightedness in thinking about not just where Walmart should be, but how does Walmart meet, the world as far as the changes that are happening, and how can you, as a major responsible corporate citizen, who actually touches the lives of people, which is very different from some of the other large companies. You actually touch people where they live in very, very meaningful ways. So the fact that you are helping to lead and anticipating, how the world is going to change and how Walmart, can be a part of that change, it's just really great to hear. We only have, 5 minutes left, 4 or 5 minutes left. There's one question that maybe you can answer real quick. I guess there's discussion now about airborne spread of the virus. Do you expect that that's going to change anything? Or is that really the case? Do we need to be worried about that?
I think one of the really interesting things about this epidemic is that we learned about the virus fairly early on in the course of the illness. If you think back on other epidemics or pandemics, sometimes they proceeded for months and months before we knew what the cause was. Well, we very early identified the cause. We identified the sequence, the RNA sequence of the virus, but there's still so much we have to learn about the virus, how it's spread, how it affects people, which people are more affected, what treatments are effective. So there's so much more to learn about the virus, and we're going to keep seeing these things. And again, I know some people find this frustrating, but you and I, from a public health perspective, know that that's how public health and medical science advance. You test hypotheses, you test, you see, and you learn, and you put things out there, and you say, we think this, and then we test it or we observe more, and then we learn that it's different than what we might have initially thought. So I think all these things of surface contamination or airborne transmission, I think those are all things that we're continuing to sort out. But the good news in all that is that, again, those very basic messages that have gotten out and I think have been really widely adopted of hand washing and social distancing and staying home when you're sick and wearing a mask, those are all good. They're all helpful in various ways, but all helpful across all of the possibilities here.
I really love your answer. Thank you. When I hear people say, well, they told us this last month and now they're telling us that and they were wrong. It's an evolving issue right now. We're learning every day new things about this virus and about human behavior, where we have to adjust as we go along. So it's not that wrong decisions were made. It was that the best decision was made based on the information and the data at that time. As new information comes, and we're even coming up with new questions to ask that we hadn't even thought about when it first came in terms of the research, and we're learning. Every day we learn new information. So we do ask the public to understand that the scientists, the public health experts and others, they are experts in process, but they're not expert in what's going to happen next all the time. But I think that as a public health community, politics aside, that we're doing a pretty good job. And some of this is just so basic and so simple. Wash your hands, distance. You don't have to be a rocket scientist to see how that can help in controlling the spread of disease. Wash your hands, distance, wear a mask. It's just as simple as that. It's not in this together.
We're in this together, and let's make it work for everybody. And just want to say again that I'm so proud of our associates and so grateful for all they've done for their communities, for each other, for our customers. And I think that I'm obviously coming from a particular perspective, but I think that's a real model for how we can move forward together, really helping each other, watching out for each other.
Well, I certainly thank you. Thank you, and thank Walmart, for allowing you to be here today, because there has been just a wealth of information. I certainly learned a lot. So I really appreciate you taking the time to do this. Walmart is making a difference. Special thank you, of course, to IWF, for hosting this through their digital programming. And it's been enlightening. And thank you to all of you that listened in and asked questions. And I hope it's been helpful. And we will challenge IWF to provide whatever follow-up needs to happen as a result of today. So again, thank you so much. And we are in this together. And this too shall pass, but we'll be better prepared for the next one.
That's
So
right.
again, so thank you everybody. And thank you again, Dr. Van Gilder.
Thank you.